Coffee's good. I like my coffee strong. I actually made some instant coffee today. I'm not sure if you guys are into instant coffee, but I do have a French press, and I do make some cold brew in the summer times, but I'm a big fan of the French press. It's just sometimes I just like to be quick and on the go, and instant coffee is always pretty clutch because you just put it in there, put some water on it, and it's good. There's no coffee grounds to worry about. You don't got to worry about wash a French press, and then so on and so forth. Sometimes I prefer this sometimes, the instant coffee, because if I'm drinking like 3 or 4 cups a day, that's a lot. Sometimes you just need a little caffeine, you know what I'm saying? It's a little bit easier because if you put a bunch in a French press, well, guess what? It gets cold, you know? And I don't want to have to remake it in a French press. But now that I'm thinking about this, I could maybe just put a good amount of coffee grounds in a French press, put a little bit of water, use that coffee, and then if I want fresh coffee, I could probably just boil the water again and put it in there. Because usually what I do with the French press is I just put the coffee grounds in and fill it up almost all the way, and then I just sip on there for the whole day. But it gets cold, so I guess it will make sense to maybe just add a little bit of warm water each time versus just having a large batch. Yeah, well, see, guys, these breakthroughs I'm having on this podcast, you know, news to you is news to me, news to me is news to you. You know what I'm saying? All right, so the last thing here I want to touch base upon is what is going on with Steward Health Care. So Steward Health Care is based out of Dallas, currently operates across Arizona, Arkansas, Florida, Louisiana, Massachusetts, Ohio, Pennsylvania, and Texas. Steward is the largest private tax-paying hospital system in the country with 33 hospitals, more than 25 urgent care centers, and 107 preferred skilled nursing facilities. So the system reports caring for about 2.2 million people a year and providing 12 million people with an encounter each year. So this is a giant issue, and this is a, like I say, scandal, because it's not a scandal, but this is pretty groundbreaking stuff, because this is one of the largest, if not the largest, private tax-paying hospital system. Majority of the hospitals you see are nonprofits. A lot of them are either linked to charities or they're linked to religious groups and other nonprofit organizations. So lots of times, for majority of you guys that are listening, I guarantee you work for a nonprofit hospital. I work for a nonprofit hospital. It's run by, I believe, like a church or some entity of the church. So that's usually how things are run. For-profit hospitals are really hard to come across by because they abide by, I don't want to say different quality measures, but they just abide differently than these for-profit ones. And it's really hard for a hospital to be privately owned and functional because there's not a lot of them. I mean, I'm not an expert. I don't know what jurisdiction is differentiated between private and public and nonprofit, but the fact that there's a lot more nonprofit hospitals, I see that making private hospitals is probably a lot harder than making a nonprofit hospital. So what is going on here is that Steward Health Care owns $50 million in unpaid debts. So they're $50 million in debt, and they're not sure how they're going to pay for this. And actually in January, they started talking to people and agencies about restructuring. They're thinking about closing down certain hospitals, and there is some threats. Well, I don't want to say threats, but there is some looming potential of them maybe going through bankruptcy. So if you find yourself working at one of these Steward Health centers, I'm not saying to quit, but maybe start to figure out, hey, is this one of the hospitals that they might, start to close down? I actually worked for a hospital in Oakland on a travel nursing assignment where the hospital was getting closed down because the safety building measures weren't in line with the city or state's requirements, because they changed some laws, they changed some stuff over the years, and the safety requirements for this building that it had to meet, they were not able to meet, because they realized that, hey, to meet these requirements, it's going to cost us a lot more money than we have, and it's just not sustainable for them to implement those measures. So they were thinking about either building a new hospital or just closing it down, which was interesting because that's the first time I ever worked in a hospital that's facing that. So I felt like a lot of the resources were, I don't want to say diminishing, but there was a lot less resources there than other hospitals. So I feel like they were slowly kind of closing down. They closed down a couple units right before I started travel nursing there. So slowly it looked like it was going to be shut down. And now that I think about it, it would have been cool to look the hospital up, because the general consensus when I was asking management there and the charge nurses and just administrators, people were thinking that's most likely going to get closed down. So they get closed down, not 100% sure. But Steward Health Care is going through some financial troubles. So we'll see. I know over the last couple years, Steward Health bought out a lot of hospitals that were going to close down or get bankrupt. So maybe this is one of the reasons why they're kind of struggling financially, because they did pick up a lot of hospitals that were struggling financially, and they thought that they could maybe potentially have them bounce back and become profitable, or at least generate some kind of income or even break even, just to kind of keep it rolling. So it's interesting to see what's going to be happening with that in these next couple of months. So stay tuned for that. If you're really interested in this, you can just look it up on Google and just find some more information. But to my knowledge, that Steward Health Care's annual revenue is $8 billion. So that's a lot of money. When you think about the $50 million that it owns in debt, might not seem like a lot, but this is $8 billion in revenue. This is everything that kind of comes in. It's not the profit that they're making, So I tried to figure out what their annual profit is, but I couldn't really find much information about the annual profit. So just because you're bringing in a lot of revenue doesn't mean you're profitable, and doesn't mean you're going to be able to ever generate a profit. This is revenue. This is just the transaction of money, the whole grand scale of things, because you're not sure how much that's going out. You're not sure about more the details. So $8 billion is just how much money they're transacting, things like that. But they could have $8 billion in revenue, but have $10 million in losses. Technically, they could be net negative. So it's a big chunk. So if this hospital does go under, if this system does go under, I would only imagine that it would deal a pretty big impact to just the whole healthcare sector. I know the healthcare sector is trillions and trillions of dollars, but just the $8 billion, imagine how much people are going to lose their job. If they have 33 hospitals, and let's just say 15 hospitals closed down, that's a lot of nurses, CNAs, physicians, respiratory therapists, housekeeping, dietary, physical therapy, occupational therapists, all people losing their jobs. So it might not seem like a big deal on a grand scale of things, but more community-based, it does seem like a pretty big deal. So this made me think about, how do hospitals actually make money? Like, where does the money come from? How does a hospital generate money, right? Because as nurses, we don't really see how the money flows, where it comes from. We have an idea of like, okay, yeah, I'm sure insurance pays and patients pay, and then procedures cost X amount of money, so that gets reimbursed.